Thank you. I'm Dr. Bennett. It is so exciting to be here today. I wanted to say that I am a psychologist and a ketamine specialist. I work in partnership with physicians who prescribe and administer ketamine. I'm not allowed to do that as a psychologist. But my specialty is in working with people who have severe depression or who are on the bipolar spectrum or who are actively suicidal. And I got frustrated with how slow conventional treatment was for this population. And I was interested in what could be done that was faster, and I became interested in ketamine. And in addition, over time, I became interested in using ketamine as an adjunct to psychotherapy for self-exploration. I've been fascinated by it for about 15 years since I first encountered it and first noticed that it appeared to have a very rapid-acting and robust antidepressant effect that I hadn't heard about at that time, and I wanted to find out, how is it doing that? And that somehow led to this moment. So here we are. And I also wanted to mention that I run the international conference on the use of ketamine in psychiatry and psychotherapy. Let's give this a wing ding. Okay, so I'm gonna just try to be short and sweet and to the point. I have a couple of things that I wanted to say today. The first thing that I wanted to point out is that ketamine is used in a number of different ways in medicine and in psychiatry and in psychotherapy, and that the populations are quite different and the treatment is quite different. The way that we use ketamine to treat depression has some overlap with, but is also different from, the way that we use ketamine for spiritual exploration. And it has some similarity to, but is also different from, how ketamine is used to manage physical pain. And it's also similar to, but also different from, ketamine for depression is similar to, but different from how ketamine is used as a surgical and procedural anesthetic. And so in listening to the talks, it's important to be thinking about what are the goals of treatment for the patient that we're discussing, and what is the route of administration that we're talking about, what's the dosing strategy that we're talking about, and why? Who is this targeted for? I just wanted to make that distinction because otherwise it's easy to get confused. There's a lot of information. I'm not going to talk about all of these, but I did want to point out that there are at least 7 different established dosing strategies for the use of ketamine. I'm going to be talking about 3 of them, the 3 that are mostly used in the treatment of severe and refractory depression and other psychiatric disorders. But I just wanted to point out that there's a lot of different dosing strategies. Unfortunately, we don't have time for all of that today. So let me just clear up a couple of things that I get the same questions over and over again, and I actually have gotten this question a number of times this weekend. So let me just cut to the chase. The National Institute of Mental Health and also recently the American Psychiatric Association have been publishing results about the use of ketamine in the treatment of people with severe depression who are getting what we call low dose, that's air quotes, low dose ketamine administered by IV. And so here's a picture of someone getting their IV low-dose ketamine treatment. I'm not going to go into great detail about this, but what I really wanted to say about it is that this dosing strategy has been pretty well established as being a very helpful adjunct to conventional treatment. What I mean by that is ketamine as an adjunct or in addition to psychotherapy and medication. And what's important is that this strategy, this way of using ketamine, is specifically designed to be sub-psychedelic, meaning on purpose the patient is not having psychedelic experience. That's the purpose of this dosing strategy, is to avoid having psychedelic experience. And I have a lot I want to say about that. I'll save that for another day. But I wanted to just point out that when doctors are talking about the use of ketamine in this way, they're thinking about ketamine purely as a pharmaceutical, as a medication where the medicine is doing all the work, but the patient doesn't have to do all that much except show up to the appointment. And it's not uncommon that patients are invited to pop on their headphones and rock it out, listen to music during their treatment. And I'm not saying there's anything wrong with that, but I want to be clear that that's a specific way of approaching ketamine treatment, but not the only way. Okay? Let's keep going, because time is short. A different way of using ketamine in the world of psychiatry is using a little bit more ketamine, a moderate dose of ketamine. And in this case, we're using the ketamine as a lubricant for psychotherapy. So the patient is relaxed on purpose by the ketamine, and we're using the time to go more deeply, using the ketamine session to go more deeply into material that the patient has been working on in psychotherapy, but maybe hasn't quite been able to get to yet, or maybe they're feeling really stuck. And I want to be clear that this is a different approach to using ketamine than what I just said a second ago. And I also want to just tell you honestly that I'm not convinced that ketamine is necessarily the best tool for this job, and it's certainly not the only tool for this job, but it's a legal tool for this job. So for now, this is what we got, and so this is what we're doing. It's perfectly legal. Here's a little bit more information on that. And what I want to say about it is that when we're working from this paradigm, when we're working in this way, using ketamine like this, we think that the thing that is helping people with their depression is not only the chemical effect of the ketamine, but also the effect of the deep psychotherapy. So it's the content and the relationship and what happens interpersonally between the therapist and the patient that is helping or enhancing the therapeutic effect of the treatment. This has not been studied, but this is the idea behind it. I just wanted you to know that. Okay. I also want to talk about what we're calling high-dose, air quotes, high-dose psychedelic ketamine treatment. This is where we're administering ketamine at a dose that's approaching the anesthetic dose, where we are inducing psychedelic and mystical experiences on purpose. People who work from this paradigm believe that it's the content of the visions, the mystical visions, that have healing properties in addition to the other things that I already mentioned. This has not been well studied. It's controversial. There's a number of qualitative papers about this, or anecdotal papers about this, that suggest that this is helpful for some patients some of the time. I want to add that I'm talking only here about people with severe depression. I just think this is a phenomena and a treatment strategy that's just begging to be studied more. Let me just show you the next slide real quick. So that's what I want to say about this. And I just want to reemphasize that the basic paradigm here is a shamanic or a psychedelic paradigm, where the psychedelic visions are part of the therapeutic effect in helping people with their depression. How am I doing on time, Phil?
1 more minute.
1 more, oh dear, okay, I'm really sorry that I only have 1 more minute, but let me just wrap this up real quick by saying that this is the same information I just presented in a table format, emphasizing that there are different paradigms, different approaches to ketamine treatment. And if you're a patient, particularly a patient with severe depression who's looking for treatment, please ask your provider, what paradigm are you using? What dosing strategy are you using and why? And if you're a provider, what dosing strategy are you using and why? And please be explicit about that and explain that to your patients. I also just want to say, people ask me all the time, which one works the best? And the answer is, it depends. It depends on the person. Different things work well for different people. I wanted to touch very quickly in 30 seconds or less on some of the prominent themes in high-dose ketamine. I don't really have too much time to do that, but ask me later. But people talk, but I'm just going to skip that. But I'll just show you real quick. You can take it in with your eyes. Things that people talk about in high-dose ketamine treatment for depression. Okay, I'm going to just pop to the very end here and say that I do run the international conference on this topic, on the use of ketamine in psychiatry and psychotherapy. It's in November. It's here in the Bay Area. please look it up on the website or catch me later if you'd like more information about that. Thank you.